Good morning, Dustin.
Good morning. How are you?
I'm doing pretty well. So you're recording live from your basement. Where do you live?
I'm in Menominee Falls. So yeah, I'm hunkered down in my basement.
And for those GMC members who might not have had the chance to meet you and get to know you, would you mind introducing yourself?
Sure, you're being kind because we just joked about my attendance at GMC. Could be a little bit better. So my name is Dustin Hinton. I'm the commercial group CEO for UnitedHealthcare for both Wisconsin and Michigan.
So you know what matters. As a GMC member, it's more important that you show up when called than that you attend all the meetings. And so I'm super grateful for you making time and sharing your perspective in this extraordinary moment. So let's jump on in. You know, United Healthcare is deep in the thick of it. Would you mind just sort of reflecting on kind of the unique perspective you have entering into this crisis and preparing for coming out of it?
Yeah, I think it's interesting for us. We're the state's largest health insurer. We have 1.6 million members in the state. So, for us, we don't like to go through it like everybody else, but we're an integral part of we're a puzzle piece in what's going on here. So, I want to talk a little bit today about how we're actively engaged in trying to help our members, try to help the providers, educate customers and brokers. We are living this day in and day out. It consumes us right now, as it should.
So as you talk about engagement on those various levels, what have you found to be the most productive means of informing, educating, and really combating the significant amount of misinformation about everything related to coronavirus?
Yeah, so one of the things that we've done from a communication standpoint, and this sounds counterintuitive, is we've shut down some of our communication to our members, believe it or not. So typically we're sending out constant reminders about preventative care, mammograms, get your annual physical. We've stopped a lot of that and solely focused on COVID-19, making sure that we have updated information on our website for symptom checkers, where to go for testing in local communities, making sure that mental health, our website on mental health is updated with resources that are available. But probably above all, and one of the things I'm most proud of is we've been doing regular webinars 2-3 times a week. We've had 22 webinars since March 13th. We've been doing them for our customers and brokers. They are national webinars with all of our leaders, but all of the local customers, lots of local customers and brokers have been attending them. And because COVID-19 is so fluid, we felt like we needed to be out in front of it, communicating as things have transpired and changed. It drives my staff nuts, quite honestly, because oftentimes we're breaking news as it relates to what's being covered, tests or treatment that day, and then my staff has to scramble back to get the follow-up questions from customers and whatnot. We generally like to prepare everybody, but things have been so fluid. What has really worked well are these webinars. We've had over 60,000 attendees, and those are people making decisions at employer groups and brokers that are consulting people. And we've really received positive feedback there. So that's where I would say I'm most proud of our communication.
That's really huge. So one of the things you mentioned was mental health, and that brings up the issue of a very challenging issue with how do you treat folks when we're all quarantining. And so you all have changed your policies around telemedicine and telehealth and how to manage that. Can you talk a little bit about that?
Sure. Telehealth, I actually heard it described today as the front porch of healthcare, which I thought was interesting. We've had virtual visits for a long time. They've had modest uptake. We've used national vendors like Doctors on Demand or Teladoc, Amwell. But what's really changed is, again, back to this magical date of March 13th, when a lot of things started to change. We opened up telehealth to local providers, so that whether it's behavioral health, mental health, or just going for what you typically go for an office visit, we've opened those telehealth capabilities up so that we would pay for telehealth. And I was on a call last night, actually, that showed our stats have gone through the roof with telemedicine. Nationally, we are up 17 times from the last month to the prior month, and Wisconsin, Michigan specifically is up 21 times over the same time period. I think we're a little bit higher because, we got some Detroit stats in there, which is a hot spot, and Milwaukee really is not that far behind. It is also, I won't call it a hot spot, but certainly has some accelerated cases of COVID-19.
So you have a national, regional, and a local perspective on how this is playing out. How are you taking in information and allowing it to inform the decisions you all make as a company? I mean, you do live in the midst of one of the more significant hotspots that's getting national attention. So how do you balance all those factors?
You take in a lot of things happen at the national level, and you take them in and you communicate to your local relationships with customers, providers, brokers. You share what we're doing, whether it's changing, covering the cost of treatment, which everybody started to do right away. Testing, I should say. And then slowly others have started, like us, covering the treatment of COVID-19. And some of those things just give a sense of relief to the community that they're not going to have to worry about claims or getting stuck with bills. It's our way of really stepping up and contributing. I would say I'm proud of what we've done with the provider community. I personally have been on a number of calls with our provider partners who've called really and said that they've struggled with cash flow issues. I think some of us that have read some of the articles that so much of the non-emergent procedures are being postponed. We probably know people that might need a knee surgery or something that's been delayed. That's really causing a lot of cash flow issues. One of the things that we've been able to work through both locally and nationally is typically we pay claims within 30 days. Our contracts require that. And I would say 20 days is our average turnaround time. Well, what we've done is we've changed our resources and sped up our claim payment to be 24 to 48 hours. That is a huge difference to the provider organization that needs an influx of cash right now to stay going and provide all the resources that they need to provide. So nationally, UnitedHealth Group, we evaluate that to be worth $1.7 billion. And that makes an impact nationally, but it impacts all the hospital and providers locally as well. So I'm super proud about being a part of that and then delivering that added relief to our community.
One of the challenges with UnitedHealthcare or healthcare payers as an industry is you have these dual roles. You are integral to the way that we will fight the spread of the disease and the treatment, but you're also an operating business. So can you just talk to me about how you all navigated balancing your resources, balancing your strategic decisions? You decided to cover the cost of treatment. You decided to cover the cost of testing even. Those are significant business decisions beyond the partner decisions that they exist to be. So how are you all managing that? Have you changed your decision process? How are you all coming together as leaders? How does it work?
Carefully. So I would say I'd give a lot of credit to our senior leadership at UnitedHealth Group. The increased communication of our activity and things that we're thinking about allows us to make local decisions. Our national CEO of UnitedHealth Group is named Dave Wickman. He hosts a Dave's Daily call, a video call for the entire organization. And he's communicating and talking about what we're doing as an organization, how we're reacting to things. And so again, that allows us to make local decisions, allows us to communicate and give a rest assured feeling to our members, customers, and providers, quite honestly, that we're actively engaged and can assist. I would say our biggest struggle right now is, everybody needs money, everybody needs relief, and we are in the middle of it all. So our customers are struggling right now with the downturned economy. That's been well advertised. They're looking for relief on premiums. Providers are looking for increased payment. So we are trying to balance it all, trying to assist where we can, but yet, back to your original question, keep the company moving forward so that we can do well through the duration of this. And none of us really knows how long that's going to be, but we need to be available for the long term.
So you're dialing in from your basement. So are all of your colleagues. How have you, as an executive, changed your operating process to deal with the stay-at-home orders?
It's part of it is staying connected. It's interesting. About 2 years ago, I always host an all-employee meeting. I've been CEO for the last 6 years, and we moved away from conference calls and in-person all-employee meetings to video conference calls because we had some technology issues. People in various parts of the state couldn't always hear because of background noise. And so we moved to a video conference call, and everybody, oddly enough, thought that was more personal because of this eye-to-eye conversation that you're having, and everybody could hear better. And I said, if I was going to do that, I made everybody turn on their cameras, which everybody's reluctant to do. But that helped us in this current environment that we're kind of used to doing it. And quite honestly, even now in smaller group meetings that I might have with my staff, I flip the camera on right away, and it's our way of staying connected. We joke around on kids in the background or dogs barking or things like that, but it actually helps us stay more connected on a personal level, and it helps us get through the business decisions as well, quite honestly, because then it feels like you're together.
I love it. I mean, you're clearly very comfortable kind of working in the virtual environment. It's interesting to hear that you were potentially years ahead of the curve. Do you think what we're experiencing right now will dictate a kind of a permanent transition to more virtual meetings, more everything online?
Yeah, I think that there's going to be ramifications for this, not only from an employee perspective, but as we talked before about telehealth, I think everybody's going to get more comfortable with this. I know my staff, we about a year and a half ago, we allowed everybody to work from home 1 day a week. And so that's part of that's helped with this transition. And as an organization, UnitedHealth Group is really well known for telecommuting. When you read articles about telecommuting, our organization is always like top 5, top 10 mentioned, because it's not just the sales and account management staff or our network teams, but oftentimes it's our customer service reps too that are working from home, which is interesting. It's for those that have been here for a while and do a really good job, it's actually been a reward to be able to work from home. So, we've had it in our DNA for the last few years, and now this is just going to build upon it even more. I'm sure my staff is going to ask for increased flexibility for work from home, just as well as, there'll be other people that are craving the social interaction, and some will say, I've had enough of this and will want to get back into the office. But I think I've even experienced it myself. The ability, to log in right away, no commute time. It does make for a longer workday, quite honestly, and you have to make sure that you turn it off, because it's so easy to, once you're set up at home and you got your permanent workspace, just to constantly be checking in and constantly be involved in it. So equally important sometimes is just to shut it down.
I think that's actually a very important insight you just shared. So you have a private audience with almost 200 of our region's most significant leaders. What's the thing that you would love your GMC peers to know? What's the information that you would provide access to? And what do you want to say to them?
Maybe I'll start out with an announcement that happened today. So United Health Group, Fortune 6 organization, 320,000 people. One of our umbrella operations is Optum. There's UnitedHealthcare and Optum, and the CEO for Optum just today was announced to co-lead the World Health Organization for the creation and distribution of a vaccine. His name's Sir Andrew Whitty. He used to be head up GlaxoSmithKline for 10 years. He was there for 30 years and had done a lot of vaccine work. So I think I want to share with people that we have really good people at UnitedHealthcare and United Health Group that are actively involved in COVID-19. There's other people at the organization that came up with the self-test a couple weeks ago for the COVID virus versus waiting in lines and have somebody administer the uncomfortable test to you. The fact that we came up with that, I'm proud of that. And so I think that there's a lot of touch points that I've talked about earlier today, and even these most recent two, that says our organization is highly involved and engaged. And that's not just at the national level. I would just communicate to everybody that we're doing our darndest to educate, create flexibility at the local level too. So that would be my message to GMC members.
Well, that's a very exciting announcement. Thank you for kind of breaking that news with us here. I guess that means we need to make sure we get this out as quickly as possible so that we don't.
Yeah, we don't want to be dated.
Yeah, that's fantastic. So would you like to share any secret tips you found in kind of rapid decision making? We are in a 24-hour, not only news cycle, but work cycle. What have you developed as new practices? Do you have a cycler under your desk? How are you staying fit? How are you staying active?
I'll tell you what, my little secret that has worked exceptionally well for me is I have not allowed myself to binge watch unless I've been on my treadmill.
Okay.
And so I'm probably getting in better shape right now because I'm binge watching only when I'm on the treadmill. And so I just went through Game of Thrones. I know I'm several years late on that.
You went through all of Game of Thrones?
In the last 60 days, I have. It's been ridiculous. But I'm on the treadmill at least an hour a day. And I was at the point where I was looking forward just to hit the treadmill for that. So I've kind of co-married the two and desperate to find new programs to keep that going. But that's really worked well for me. And I think that's something I'll keep going.
Would you like to make any suggestions for content that your GMC member peers should watch?
I don't know about that. In fact, I'm probably feel a little guilty that I recommended Game of Thrones. But there's plenty of stuff out there that everybody can check out.
I might follow up with you about that one offline just to see.
Yeah, there you go.
Other guilty pleasures you've had. So as we think about wrapping up this conversation, one of the challenges we've been offering in these discussions is to make a little bit of a prediction 2-3 years into the future. What kind of changes do you expect that we should experience in in just the way we do work and the way that healthcare and health insurance operates, how do you expect your life to be different?
I think there's going to be a lot of changes from this. We talked a little bit about telehealth. I think that's here to stay. I think members are getting more comfortable using it. And quite honestly, I've heard feedback from providers that they enjoy it as well, that they've actually experienced some deeper conversation with some of their patients. So I think that, breaking down those barriers, once you've tried it, once you've tried Zoom for a while, you start getting used to it and it feels comfortable. So I think telehealth is here to stay. Sadly, I think higher deductibles and out-of-pockets are coming because there's going to be increased costs with this. So I think we're going to struggle with that in the future. That the economy is clearly on a downturn. Employers are struggling. So I think you're going to see more individual coverage. I think you're going to see an increase in Medicaid coverage. As I'm focused on commercial population, I hate to see some of those shifts, but I do think that they're going to happen. I also think that there's going to be more mergers in the future, whether it's insurance companies or providers. We don't have too many independent providers left in Wisconsin, or the rural providers. I think that there's going to be resource challenges, and so mergers could happen. So those are some of the things I can see happening in the future. And then maybe lastly, we started to see some shifting from hospital settings to different sites of service, like ambulatory surgery centers. I think that there's going to be an increase in that shifting, because one of the things I think we've learned is that our hospitals can quickly get to capacity. We've seemingly have skirted that for now, but I do think that hospitals will have the mind shift of, hey, maybe we got to get a lot more work done outside of the traditional hospital four walls. So those are some of the things that are top of mind right now.
I think those predictions will prove quite prescient. We've actually been having conversations about the probability of increased M&A across industry, certainly some consolidation at the highest levels for insurance and providers, and as well as lots of professional services and places where we just frankly had redundancy and just inefficiencies in the market. So I appreciate hearing you say it, because your perspective is significantly more informed than certainly mine. Dustin, thank you so much for making some time for this conversation. Really appreciate your insights and your perspective. Excited to see you soon at an in-person GMC meeting. And we're going to be really relying on you to provide your leadership and providing your education and information in the future.
I promise I will see you soon at a GMC meeting. Thank you for your time.
So
thank you for your time today. I really appreciate it. I really appreciate your time today.
Yeah, we appreciate you as well.
All right.